Good afternoon. It is noon with me, Dr. Polly Heil-Mealey at Abundant Health and Wellness. Now, today we are going to be talking about 3D mammograms. We're going to talk about mammograms in general. I know that we just completed October, which is Breast Cancer Awareness Month, and so we definitely want to make sure that we do take care of our breasts, but there is a new push. In fact, the name of this article says the name of the article is $1 million marketing juggernaut pushes 3D mammograms. The subheading is regular 2D mammograms are less likely to show false alarms compared to 3D mammograms, according to one 2016 study. So why are your doctors wanting you to do 3D mammograms? There is a lot of information that I'm going to be sharing with you. And one of the things that I'll need you to understand is that a 2D mammogram, if you've ever had a mammogram, you know that they take the breast and they squash it between two plates. And it is painful. I have had one, and it was not comfortable, but it wasn't as excruciating as everybody had said it was. But what I have learned, and I had one more than 10 years ago, so I haven't had one recently. What I have had recently is thermography, and that's what we recommend. We have Angel who comes in to see us, and I'll tell you a little bit more about her. But we do recommend thermal imaging. Now, why do we recommend thermal imaging? Because thermal imaging does not use any radiation. It does not compress the breast at any way or any shape. And also, according to the research that I read, once you have a mammogram and you see that you have a lump or you have a suspicious mass, that mass has been there 5 to 10 years before it is big enough to be detected on a mammogram. So thermography, on the other hand, thermography can show thermal changes in the breast up to 10 years earlier, than a mammogram. So it's really important that you understand, do your own research, look at people, look at what they say, and then you'll be able to determine what you need to do about your own breast. We do not recommend mammogram, but we do recommend thermography. We do recommend self-breast checks. In fact, there was a study done with 50,000 women, so that's a pretty big sampling. It was a 25-year study. It was a Canadian study, if that matters to anybody. And they said that mammograms do not lower breast cancer mortality, not even by 1%. They said that they found out with this 25-year study, right, that the effectiveness of a mammogram is as effective or equal to what you do with breast examination. So that's something that's really important. And again, this was a 25-year study, over 50,000 women. So this research is not clear that mammograms help. Okay, now I know there are going to be some people that say, well, I went and had a mammogram, I found something, they excised it, and I'm fine, and yay, and I'm glad that happened. I heard one naturopath say that breast cancer is one of the easiest cancers to reverse because your breast tissue is lymphatic tissue. And if you keep the lymph moving, that it's easy to rectify this condition. Now, I don't want to give you a lot of false hope, okay? It's better not to get cancer than to try to recover from cancer. So keeping your lymphatic system in top working order is really, really important. And so we want to make sure that you're able to do all the healthy things that you need to do. I was looking at a website today, we call her Dr. V in the holistic world. She's a Canadian doctor, Veronique Desaulniers. I think that's how you say that. Anyway, she has cured herself twice of breast cancer. And she says that cancer is an environment, and we know that that is to be so. So if you clean up the environment of the lymphatic system, you get everything working the way it needs to be working, then you're going to be less likely to have any kind of unfortunate diagnosis in your future. So we're looking at this research about 3D mammograms, and it says researchers raise questions about the benefit of the new machines as industry-paid doctors promote them. And so this is what you need to understand. Where is the money? Follow the money. So these are being promoted by doctors who are being paid to promote. Now, there is an organization called the KHN. I think that stands for the Kaiser Health News. There was nowhere in this article that it definitely said that's who it was, but I think that's who it was. This investigation found that manufacturers, hospitals, doctors, and some patient advocates have put their marketing muscle and millions of dollars behind 3D mammograms. Okay? The juggernaut has left many women feeling pressured to undergo screenings that, according to the U.S. Preventative Services Task Force, have not been shown to be more effective than a traditional mammogram. And remember, this 25-year, 50,000 patient study in Canada showed that mammograms were pretty ineffective at all at preventing cancer. It says there's a lot of money to be made, says Dr. Stephen Woloshin, the director for the Center of Medicine and Media at Dartmouth Institute. It is at the Health Policy and Clinical Practice. Okay, that is at Dartmouth University, who published a study in January showing that the healthcare industry spends $30 billion a year on marketing. That's a lot of your budget, $30 billion with a B dollars a year on marketing. The investigators show that the industry money has shaped policy, public opinion, and patient care around 3D mammograms. So this is important. We are being manipulated. You always need to go behind the scenes of the advertisements and find out who paid for it. Is it a peer-reviewed study? You need to do your due diligence because we are very easily manipulated. One of the reasons or one of the ways that they do this is they pay influential doctors. It says in the past 6 years, 3D equipment manufacturers, including Hologic, GE Healthcare, and Siemens Medical Solutions USA, and Fujifilm Medical Systems USA, have paid doctors and teaching hospitals more than $240 million related to 3D mammograms, according to the KHN analysis of the Medicare Open Payments database. That's a lot of money, okay? Just over half of that money was related to research. The other payments covered speaking fees, consulting, travel, meals, and drinks. The database shows influential journal articles, those cited hundreds of times by other researchers, were written by doctors with financial ties to 3D companies. So this is important. If you're paying me and I'm going to write a review about your whatever it is, if you're paying me, I'm going to write a good review. Because why? Because you're not going to pay me if I write a bad review. I don't know if you've seen the commercial on the TV where it's some kind of a bundle hotel reservation, and they've got the bed in the kitchen, and the guy says, so we're going to be sleeping in the kitchen, and the proprietor says, yes, but I know you're going to write a good review over it because it's a free service. So, that's kind of the way it is. If you're paying somebody to review something for you, are you really going to get a true review? We hope that you would, but I'm not so sure. Marketing is directed at the consumer. Okay, Steve and I, that's my husband, Steve and I laugh all the time when we see these prescription commercials and it says, ask your doctor if this is right for you. And we look at each other and Steve says, well, my doctor is smarter than me. Shouldn't my doctor tell me what's right for me? I should not have to go in there and ask my doctor if this is right for me. And so part of the way that they are manipulating us is they are marketing straight to us. Manufacturers have urged women to demand, quote, the better mammogram, unquote, using celebrity spokeswomen such as breast cancer survivor Sheryl Crow. Manufacturers spend $14 million to market 3D screening over the past 4 years. Okay, that's a lot of money. There is lobbying at the state lawmaker level. So private insurers in 16 states are now legally required to cover 3D screenings, along with Medicaid programs in 36 states and Washington, D.C. Officials at Hologic, the leading manufacturer, told the KHN people that about 95% of insured women have coverage for 3D mammograms. Now, a 3D mammogram, they take pictures of the breast at varying different angles. That's what's different about it. And they say that because they're doing it at the various different angles, they're more able to detect any kind of lump or mass that may be hidden in the traditional 2D style, okay? So I don't know that that's true, but they're certainly spending a lot of money saying that it is. So they are funding experts and advocates. So all of these people that are going around talking about 3D mammograms being better than the 2D are being paid by the 3D manufacturers, by that industry. It says Hologic has given educational grants to American Society of Breast Surgeons, a medical association that recently recommended 3D mammograms as its preferred screening method. Well, I guess so. If you're giving them all kinds of free stuff, they're going to recommend you. Okay. Hologic declined to reveal the amounts of money they were paid. Hologic also has funded patient advocates such as the Black Women's Health Imperative, which lobbies for access to 3D mammograms. Okay. It says taxpayers write the check for many 3D screenings, which adds about $50 to the cost of a typical mammogram. Medicare, which began paying for 3D exams in 2015, spent additional $230 million on breast cancer screening within the first 3 years of coverage. By 2017, nearly half of the mammograms paid for by the federal program were 3D, according to the analysis of federal data. Okay, so that's important. Let me just see here. On average, 3D screenings may slightly increase cancer detection rates, finding about one extra breast tumor for every 1,000 women screened, according to the 2018 analysis. So it's not that much more effective, 1 out of 1,000. So you need to weigh in if that's enough for you. I personally don't do x-rays. When I go to the dentist and they absolutely insist on x-raying, which is probably once every 3 years, I make sure that they do a thyroid guard when they put that lead apron, on top of you. I make sure that they do a thyroid guard because I don't want my thyroid irradiated. I don't want to eradicate it either, irradiated. And so you want to make sure that you limit your exposure. So for that reason, I don't do mammograms. There is a lot of information out there that says that the level of radiation that you get with a mammogram, I have heard it is equivalent to 1,000 chest x-rays. Okay, so every time you have a mammogram, you are putting more radiation into the breast. And what does radiation do? Radiation damages DNA. So you need to weigh up whether that is something that you want to do. And the 3D has a little bit more radiation, I think. We're going to get to that in just a minute. I read this a couple of days ago. And so the same study said that it shows that 3D screenings cause fewer, quote, false alarms in which women are called back from procedures that they didn't need. This is from the Hologic vice president. Yet, newer technology is not necessarily better, and it can cause harm. Dr. Otis Brawley, a professor at Johns Hopkins University, said, "It is unethical to push a product before you know it helps people." Now, I just want to say, on one side of this paper, it says 3D mammograms are no better at showing, are less likely to show false positives. And I just read over here that it's more likely to show false positives. So I don't know which one is a typo on here, but I know somebody caught that, and I caught it too, and I read it this time around. Okay. He says, can we say 3D is better? He says, we don't know. So again, we're being guinea pigs, and so you just need to take that into consideration. The American Cancer Society, Susan G. Komen, and the U.S. Preventive Services Task Force say there is not enough evidence to advise women on 3D mammograms. All right. When the Food and Drug Administration approved the first 3D mammography system made by Hologic, the agency required the technology to be safe and effective at finding breast cancer, not at improving survival. So, does it improve your chances of survival? This is what we want. This is why we go and get breast exams, or this is why we do breast exams. This is why we do thermography, is that we want to see, is there anything going on underneath? Why? Because we want to survive the assault. So this article is saying they weren't required to prove that this method was effective at healing breast cancer. They're just saying it's effective at finding things. Okay, so that's a big thing. It says the companies do minimal research needed to get the FDA approval, and that usually means that no meaningful evidence of how it helps the patient, said Diana Zuckerman, president of the National Center for Health Research. Now, that's something we do here in the clinic, quite a few things, and my motivation is for you to get well. My motivation is not to sell products. My motivation is that you get what you need in order that your body can heal, and that's what we want. Here, they're doing the minimum amount of research to get approval. And then the motivation is to get approval, not necessarily to help the patient. So that's really, really important. We have to understand the motivation. This is a quote. The evidence was overwhelmingly positive that the 3D was a superior mammogram. However, this was done by the company wanting the approval. So can you trust somebody who says, I made my product, I know my product is good, you just have to trust me because I made the product? Well, I want independent research. I want independent labs to tell me what is true and what is not true. I mean, I'm just kind of picky like that. I remember sitting in church one day and the pastor said that XYZ was located in the Bible and gave this, scriptural address, and I turned to it because I want to see if what he's telling me is the truth. And my husband used to say I was the quality control person, making sure that the pastor lined up with the scripture. Well, I think that's important. I don't think that you need to take somebody else's word for it. I think you need to know for yourself. And I also think you are your own best advocate for health, and you need to know what's going on so you can make the best judgment and you can make the best decisions for your own body. Okay? It says, like all mammograms, the 3D version carries risks. Older 3D systems expose women to twice as much radiation as a 2D mammogram. Okay, although it says those levels are still considered safe, and this was by Dr. Diana, and I wrote through the names, I can't tell you, but she is a biostatistics professor at the University of California, Davis School of Medicine. I do not want to have a mammogram that has twice the level of radiation. Okay, so y'all need to think about that. Think about what that's worth to you. Okay. Diagnosing more cancers does not necessarily help women. That's because not all breast tumors are life-threatening. Some grow so slowly that the women would live just as long as they ignored them or never even knew they were there. Finding these tumors often lead women to undergo treatment that they don't need, right? An estimated 2017 study estimated 1 in 3 women with breast cancer detected by a mammogram are treated unnecessarily. And it is possible that 3D mammograms make the problem worse by finding even more small or slow-growing tumors than the 2D. This was by Dr. Christ, who is the vice chairman of the U.S. Preventive Services Task Force. All right. He says that by steering women toward 3D mammograms before all the evidence is in, we could potentially hurt women. Some experts worry that women who tend to overestimate their risk of dying from breast cancer are acting out of fear when they choose treatment. So this is really, really important. We want to be wise. I don't want anybody to think that I'm saying don't examine your breast, because I'm not saying that. What I'm saying is figure out what is the right machine for you, figure out what is the right frequency for you, and look at the research yourself. Now, I looked at Truth About Cancer several years ago, and they were talking about mammograms and how the 2D, when it presses on the breast, and it is uncomfortable, but they have to flatten the breast so they can get that flat plane, okay? The Truth About Cancer people say that pressing of those plates can actually burst small tumors and spread the cancer. That makes sense to me. I think that your breasts are tender and that you need to treat them very, very lovingly and tenderly, and anytime that there's trauma to the breast can lead to problems with the DNA, and so we don't want that. We don't want the radiation going into the breast to mess up the DNA and that kind of thing. And we need to understand too, and I've said this before, that your underwire bras, okay, ladies, hopefully you have thrown those away, or they are in the bottom of your drawer and you only bring them out for special occasions and short duration, because that underwire cuts off the flow of lymph, and it is lymph fluid that cleans your tissue. Now, we told you a while ago that breast tissue is lymphatic tissue. So if you've got those underwires, the underwire is actually blocking the lymph flow. Now remember, you've got lymph nodes under your arm, you've got them down your spinal column, you've got them in your groin, and you've got them behind your knees. And so if you have those underwires, and it's a horseshoe wire that cups the breast, and people like them because it makes you perky, okay? And I appreciate that and I understand that, but it's not worth it to me to be perky, okay, at the expense of my lymphatic system. Now, I will just tell you, and I do not get paid by Soma, just gonna throw that out there, but I did, when I got really serious about this, I started looking for bras that were for big girls, but did not have underwire in them. And so I went to Soma, S-O-M-A, and they have really good, well-constructed bras for us well-endowed women with no underwire. So there are ways around it. Warner has a bra that is cut on the bias on the inside, so it supports without the underwire. So there are other alternatives, but you've got to search them out, and it has to be important to you. I'm not getting paid by either of those two companies. I have worn both of their bras, and I like the fact that I have options so that I'm not blocking the lymph from the breast tissue, so that's important. Okay, so Dr. Linda Greer, she is a community radiologist in Phoenix, says she's shocked, okay, by how many more tumors were detected with 3D than 2D, right? In an interview, she told Everyday Health, "We get scared about what we're missing for so many years with the 2D mammograms." However, Greer has accepted more than $305,000 from the makers of the mammogram machine, okay? This includes $222,000 related specifically to 3D products. So if I'm getting paid, again, if I'm getting paid by the people that are wanting me to promote their product, am I a reliable witness? So I'm just going to leave that out there and you can figure that out. All right. So building the brand. This is another way that the industry is promoting these mammograms, building a brand. The first question many women have about 3D mammograms is, are they painful? In the ads, Hologic claims that the 3D device was less painful for 93% of the women. But the claim comes from a small company-funded study that has not been peer-reviewed. Given the limited data in the study, it's possible that the findings were the result of chance, who calls the ads very, very misleading, okay? Valente said peer review is important in studies about cancer detection or false alarms, but when it relates to general patient satisfaction or patient preference, the data is, or those are the data that we get in other ways, he says. Plenty of doctors have the 3D system now, and you can get feedback from them. It says, while screenings may not generate a lot of income, they attract patients who need other more profitable healthcare procedures. Anytime you diagnose more tumors, you get more income for tumors, says the director of health policy research at Harvard University, JFK School of Government. So this is important. A few weeks ago, while my husband was at the Deer Lease, I was watching movies on Netflix, and I watched the movie called What the Health, Health. And this guy was going around trying to get the scoop on different medical procedures and different things like that. And he actually went to a hospital, and he wanted to interview a doctor, and I think it was about diabetes. Now, I may not be right. It was a couple of weeks ago I watched this movie. But he went and he wanted to talk to this doctor about why the doctor did not promote changing your diet, changing your lifestyle, blah, 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 blah. So he didn't get an appointment, but he finally got an appointment. So when he actually went to the hospital on that day, he was met by, I don't know if it was the PA to the doctor or the executive assistant. I don't know who it was, but it was somebody who was official. And she came out and she said, the doctor's not going to meet with you. And he said, but I had an appointment. And she said, yes, but you want to talk about holistic alternatives. And we make a lot of money on these procedures, and we're just not interested in discussing those options. And I was absolutely flabbergasted that somebody in scrubs in a hospital setting would actually say that out loud. I mean, I think that, a lot of people think that, but for somebody in the industry to say out loud, we don't want to use or talk about holistic methods because we make too much money treating this sickness. To me, I just wonder where their motivation is. What is the motivation? Because for me, the motivation is to get you healthy, which is why I am giving you this information. Now, these companies pay the doctors. All right. It says Dr. Stephen Rose has been especially effective advocating the 3D screenings. He's a radiologist. He testified on behalf of the Texas insurance bill twice. Texas is my state. The practice where Rose works, Solis Mammography, put out press releases in favor of this legislation. In 2010, Rose testified in favor of 3D screenings and at the FDA advisory panel. Now, in the past 6 years, he has received $317,000 from companies that manufacture mammogram machines, okay? In 2014, Rose co-wrote an influential pamphlet that described the benefits of 3D mammography. Collectively, Rose and 12 of his co-authors accepted more than $1 million from the 4 leading manufacturers of 3D equipment over the past 3 years. Okay, that is important. Oh, not 3 years, 6 years. Okay, I apologize for that. $1 million. So you got to follow the money. So this is some information you can figure out if you like it or not. We use Angel Marlowe. Her email, y'all can write this down. Okay, her email is info@thermalimagingtexas.com. Okay, I think we have a link on our own website. Her name is Angel Marlowe. She is an advanced clinical thermographer. This is what Steve and I do. We do the whole body thing. I want to know what's going on with my teeth. I want to know what's going on with the tatas. I want to know what's going on in the bowel. I want to know what's going on in my feet. So I do the full body scan. I don't do it every year, okay? But I do that as a baseline, and then I have done the breast multiple times to see kind of where I am on that. And it is non-invasive. There's no radiation, and so it is just a good thing. So I'm going to leave you with that. We'll put her number and her website and everything under the comments here so you can call her. She's got several different locations, but she comes here about once every 6 weeks, and so we'd love to see you here at the clinic. We're in downtown Humble at Avenue C and Main Street. I want you guys to have a great weekend. Now, I will not be with you next Friday because it's the Thanksgiving holidays and we are closed, so I won't see you next week, but I want you to have a great Thanksgiving. Be grateful. Be grateful that we have health choices. Be grateful that we can treat our bodies the way we want to treat our bodies, and we don't have to just be led around and manipulated by ad campaigns and dollars. So love you guys. Thank you so much for visiting with me. If you have any questions, pop them in the box, and I will talk to you soon. Take care. Bye-bye.